The death toll in China from the COVID-19 virus has jumped by a record number in a single day. 254 new deaths have been reported over the past 24 hours, taking the number of fatalities nationwide to 1,367. The number of confirmed cases has also skyrocketed to nearly 60,000. Now, the reason for the surge is a change in the way authorities are confirming a diagnosis. So until yesterday, cases were only confirmed using RNA tests. That's when a doctor swabs a patient's nose and mouth, and then the samples are sent to a lab, which can take days to confirm an infection. Now, officials can rely on speedy CT scans of the chest, and doctors will look at the scans for signs of lung infections to confirm a diagnosis. This will then allow patients to be treated more quickly and improve chances of recovery. As anger spreads over the government's handling of the epidemic, China's Communist Party has sacked another top leader in Hubei province. Jiang Chaoliang, Hubei's party secretary, has been replaced by Shanghai Mayor Ying Yong. And China correspondent Lynette Lim is with us right now.
Lynette, there's been a big jump in the number of people who've died, as well as these infections, because of this new diagnostic test. Is how far are concerns heightening in China? They must be at this point.
Members of the public are rightly concerned. However, some scientists and statisticians have said that this is actually a positive, because they have been saying for the longest time that there's undercounting of the cases, and they have been pushing for a review of the way the cases are being diagnosed, because according to the previous method, confirmed cases are only confirmed if patients test positive under the RNA or nucleic acid test. But we know there are some flaws with this test, because we know that a government official has recently said that the accuracy is 30 to 40%. We've seen reports where people test positive only after 4 or 5 tests being taken. So, there are some doubts over the accuracy, and this is seen as a positive step, because this suggests that there are people who test positive only very late in the process, and the new diagnostic method will cover them and capture them, and also identify, isolate, and treat them.
Lynette, so let's look at what's happening in China, the Hubei official being sacked. Can you tell us, what does it read about this whole reshuffle that's currently going on?
It actually follows a familiar process as to how the Chinese Communist Party deals with crises. So looking at back in the SARS period, we also saw something similar happen, i.e. the local officials are being purged in favor of officials close to the center or officials directly from the central government. Former Shanghai Mayor Ying Yong is known as a close ally of President Xi Jinping. They worked together when Mr. Xi was the party chief for Zhejiang province, and the two of them, they know each other very well all these years. In his earliest remarks, since taking the post, we're just hearing these remarks right now. He said that he pledged to contain the virus situation, that the situation is still very severe, and citing Mr. Xi, he said that controlling the situation directly relates to China's economic and social stability.
All right, thanks, Lynette, for that update. Lynette Lim speaking to us there.